Applying a topical anesthetic cream prior to the resurfacing helps not only in anesthetizing the patient, but also in fully hydrating the skin. This must be thoroughly wiped off prior to the procedure. The chin and lower lip may be anesthetized with a mental nerve block. Here, the needle is inserted between the first and second premolar. Topical anesthesia may be applied at this junction, and then the needle is inserted through there and down approximately 1 centimeter to the root of the mental nerve. Approximately 2 milliliters of a 1 to 2% lidocaine solution are injected. The upper lip and medial aspect of the cheek may be anesthetized with an infraorbital block. One technique involves injecting 0.2 cc's just at the sulcus above the incisor and then advancing the needle to the typical infraorbital block and placing another 2 to 3 cc's. The final position of the needle should be at the infraorbital notch located in the midpupillary line. There are many techniques used to resurface the skin. I personally prefer making the first pass with an erbium YAG laser, followed by a pass with the CO2 laser, and then finished with an additional pass of the erbium YAG laser. Here I'm using 5mm spot size with a fluence of 12 joules per centimeter squared. At this fluence with a slight overlap, the epidermis may be almost completely removed with a single pass. This is then followed by a pass with a CO2 laser. Here we have the ultrapulse laser with a pattern generator on it at 300 millijoules and a density of 5. It is critical not to overlap passes when using a carbon dioxide laser. After eye shields have been placed, we make a pass over the eyelids with a erbium YAG laser. Here at a setting of 10 joules per centimeter square, the eyelid is being treated with a 5mm spot size. When treating the lower eyelids, the wooden end of a Q-tip may be used to stretch the lower eyelid and keep the eyelashes out of the laser's way. When treating acne scars, I find it helpful to treat the shoulder or edge of the acne scar first, and then go on and treat the entire area. Here I'm using a 3mm spot size at 14 joules per centimeter squared with the erbium YAG laser. The same technique may also be used to flatten the edge of a wrinkle before treating the entire cosmetic unit. As with the prior example, the entire cosmetic unit is then treated with slightly overlapped pulses of the erbium YAG laser. Here again, the 5mm spot size was used with a 10 joule per centimeter square setting. Next, a pass is made with the ultrapulsed carbon dioxide laser. Again, it is critical not to overlap these pulses. Instead of performing the first pass with an erbium YAG laser followed by this pass with the carbon dioxide laser, many physicians prefer simply performing 2 passes with the carbon dioxide laser. Note the slight tissue contraction that occurs with each pulse with the ultrapulse laser. Following this, the entire area is thoroughly wiped down with wet gauze. It is very important to remove all of the debris created by the pass with the carbon dioxide laser. The final pass is performed again with the erbium YAG laser. Here, the 7mm spot size was used with a setting of 5 joules per centimeter squared. This pass is designed to remove some of the thermal damage created by the pass with the carbon dioxide laser. Following the procedure, an occlusive dressing is applied. Here, a Cylon dressing is being applied over the resurfaced area. The Cylon dressing is stretched over the area, and then incisions are quickly made over the nose, mouth, and eye areas. Raised scars may also be improved with resurfacing lasers. Here, the ultrapulsed laser is being used with 400 millijoules at 3 pulses per second and 1.25 watts with a small spot size to flatten down the elevated scars. Pulses are made directly over the elevated area and then slightly to the edge to feather them out. It is often helpful to treat these to a level slightly below what will be flush with the rest of the skin. This will account for the reepithelialization. Cosmetic tattoos may also be improved with resurfacing lasers. Instead of using lasers designed to treat pigmented lesions, which oftentimes require multiple treatment sessions and may turn some of the cosmetic tattoos a dark black color, a single session with the resurfacing laser may achieve the goal of removing the cosmetic tattoo. Here, a permanent lip liner is being removed with an erbium YAG resurfacing laser. The 3mm spot size is being used with a fluence of 12 joules per centimeter squared.